For 25 years, Gavi has protected over 1 billion children against infectious disease. But our work doesn't just lead to healthier communities, it also leads to healthier economies. Gavi is an integral part of the global defense against new outbreaks, epidemics, and pandemics. Our model is built on sustainability, with an unwavering commitment to innovation. We offer a hand up, not a hand out. Together, we can protect more children against more diseases. Protect our world from the threat of pandemics. And protect communities experiencing conflict, climate change, and other global challenges. Now is the time to step up, to unite behind the simple, powerful idea that together we can build a safer, stronger, and more prosperous world for all of us.
A very good evening and welcome back to the Global Summit held under the theme Health and Prosperity through Immunization. What an incredible day it's been, full of energy, insight, ambition and pledges.
Absolutely, thank you so much. And Zinga, what a day, what an evening it's going to be. Tonight, we're honored to welcome heads of state and governments, leaders whose presence signals unwavering global commitment to our shared mission.
Tonight, history meets momentum with commitments to Gavi and global immunization from country and institutional leaders. I'm honored that in just a few moments, we're going to hear from Professor Barroso, Chair of the Gavi Board, Her Excellency Ursula von der Leyen, President of the European Commission, His Excellency Antonio Costa, President of the European Council, Mr. Bill Gates, Chair of the Gates Foundation, and Dr. Sania Nishtar, Gavi's CEO. First, though, please a round of applause for Professor Barroso, Board Chair of Gavi, the Vaccine Alliance.
Your Excellencies, Heads of State and Government, dear Ministers, Excellencies, distinguished guests, ladies and gentlemen. It is truly my honor to welcome you all this evening, and I must pay special tribute to our co-hosts tonight for bringing us together in this great city of Brussels. To Ursula von der Leyen, to Antonio Costa, to Bill Gates, on behalf of Gavi, my heartfelt thanks for all that you and the institutions you represent, the European Union and its member states, and the Gates Foundation, all of that you have done and will do to make the world a healthier and more prosperous place through immunization. It strikes me that in a world that is often fragmented and polarized, we are here tonight because of something that unites us all. Whatever disagreements or differences we may have, some things bind us together across generations, across borders, and across continents. And speaking of continents, let me please make a special word to Africa and to the African Union, represented here by the chair in office, the President of Angola, João Lourenço. Thank you very much for joining us tonight. What unites us is, at the end, very simple. We want the best for our children, and I think I can say for most of us, or for some of us, for our grandchildren. The next generations, nothing is more important than saving the lives of millions of children. Rarely do we get the chance to translate that universal instinct into concerted and concrete action. This evening we have that chance. We are here to commit to a better and brighter future by committing to immunization. We know these commitments are not easy. We know the fiscal constraints, geopolitical and political challenges that confront so many of our countries. That is why tonight is not only about your commitments, the commitments of the governments, including the donor governments, it's also about our commitment as Gavi, the Vaccine Alliance. Our commitment to become an organization that is even more efficient, more agile, more collaborative, and above all, more deeply rooted in the priorities of the countries we serve. Because it's for the countries we serve that we exist, not for the organization itself. It's for the children of the world that we exist. These are our guiding stars as we deliver over the next 5 years. Gavi is indeed a unique organization in global health with a public-private model that has brought together national governments, donors, vaccine manufacturers, scientific institutes, and grassroots organizations to vaccinate more than 1 billion children in low-income and middle-income countries. In the process, Gavi has helped to halve child mortality and prevented almost 19 million deaths. It has made the whole world safer from infectious diseases and, in fact, protected from such important threats. And I have to say that Gavi has done it always following the best scientific advice, the best science in the world, putting as a very high priority vaccine safety. And it has provided an unbeatable return in investment. 25 years of Gavi-funded vaccines have unlocked $250 billion in broader economic benefits in low-income and middle-income countries. These economic benefits have in turn helped 19 of the countries that Gavi has supported to go it alone on immunization, their economies outgrowing the need for outside support to fund vital vaccines. This is a different way to do development. We don't want people to be dependent forever. We don't want countries to be dependent forever. Several countries, Gavi graduates, have come full circle to become Gavi donors. I pay tribute to them this evening. And I pay tribute to all of you. Gavi's achievements belong to every one of you who have supported it along the way. For the past 5 years, it has been my privilege to serve as chair of the board of Gavi. So when I speak about Gavi's impact on lives and economies, I am speaking from personal experience, something that I've been seeing on the ground. And when I speak about opportunities we have before us, I speak also from personal conviction. I would like to ask that all the voices that we heard during this today, from ministers from Africa, from Asia, from Latin America, from all over the world, it would be so good if those voices could reach, namely, all the donors, some people that can remain skeptical when they give concrete example of the concrete benefits that brought to their countries, how many lives were saved. By working more closely with partners, we can ensure that even children in communities affected by conflict and displacement get their basic vaccinations. And as leaders, as donors, and as partners, you are about to shape the future of immunization and the lives of 500 million children between now and 2030. Your voices tonight will shape the world of tomorrow. We all understand, and we have to be realistic about that. The world over the next years will look very differently from the recent past. We understand the concerns that we now follow about security. Now, one of the words that is the name of the game is resilience. Yes, but when you speak about resilience, when you speak about security, we should not forget about health security. Our mission is a humanitarian mission, but it's a mission that also protects the health security of everyone in the world. And we should also put that as a very important priority, the priority of health security. Historic forces of geopolitical upheaval, of turbulence in the global economy are clear for all to see. But in my experience, there is always a common ground to be found, and there is always room for hope. Indeed, hope is the sacred duty of leadership. Sometimes life, with all its complexities, presents us with a very simple choice. Yes or no to the future. Yes or no. There is no future without children. Immunization is the single most effective, cost-efficient, and scalable tool we will ever have to give every child a start in life free of preventable diseases. I can't help but feel that no matter what may be the differences in the world today, we should stand together this evening and beyond this evening and take a step forward as one into a more hopeful future for all. Thank you very much for your kind attention.
Please welcome to the stage Her Excellency Ursula von der Leyen.
Thank you very much, President Costa, dear Antonio, President Barroso, dear José Manuel, Mr. Gates, dear Bill, Presidents, Prime Ministers, Excellencies, ladies and gentlemen, vaccines have saved more lives than any other medical breakthrough during the history that we have followed now. More than 150 million lives have been saved because of vaccines over the last 50 years. And they remain our strongest shield against infectious disease. And these are not just statistics. Because think about it, behind each successful vaccination, there is a child able to grow up healthy. And there is a parent who can sleep easier at night. But protection through vaccination is also a question of access. And there we have made remarkable progress. This is in large part thanks to the extraordinary work done by Gavi. Since its creation, Gavi has immunized over 1 billion children, and it helped avert over 18 million deaths. You can also look at it from a macroeconomic point of view. You said it, José Manuel. For every dollar spent on vaccines, there's a return of $54 through lower healthcare costs and higher productivity. And that shows that vaccines don't just save lives, they also help nations to thrive. So today is the moment to reaffirm our engagement. And I'm proud to say that Europe will continue to contribute. Team Europe is Gavi's largest donor. And today, I'm pleased to pledge 360 million euros to Gavi at this summit, and this is part of a total Team Europe pledge of 2 billion euros or even more. And of course, I call on all our partners to match our level of ambition. Our aim is clear. We must keep preventable diseases from becoming preventable tragedies. Ladies and gentlemen, funding is essential, but so is building long-term resilience. During the COVID-19 pandemic, we saw how critical local production and secure supply chains are. We need to empower regions to manufacture their own vaccines. And this is particularly true for Africa, where, as you know, 99% of vaccines are still imported. And that is why we're all investing heavily in local vaccine manufacturing. As Team Europe, we have already mobilized more than 2 billion euros from Senegal to South Africa, from Nigeria to Rwanda. We are supporting to build sustainable capacity. And we will soon sign a new volume guarantee mechanism developed with the EIB and the Gates Foundation. And these will make demand more predictable, particularly for African partners. It will guarantee more than 100 million euros for the purchase of medical supplies from developing countries. So to create a market and to guarantee the uptake, that's what we have to do. And we are also working closely with Gavi on this issue. Team Europe is the largest contributor to the Africa Vaccine Manufacturing Accelerator, and I welcome Gavi and UNICEF's commitment to procure up to 20% of vaccines from African producers. So together we can ensure that vaccines are not only available to Africa, but increasingly made in Africa. Ladies and gentlemen, the story of vaccines is not just a story of innovation and medicines. It's also a story of innovation and medicines, but it is most and foremost a story of hope. Hope of what humanity can achieve through shared purpose and collective action. If we want that story to go on, we must fund Gavi's critical work. And we must also strengthen the global health architecture to make it fit for purpose in a time of constrained budgets and rising threats. Let's ensure that progress persists. Let us continue writing this global success story together. Thank you very much and have a good evening. Thank you.
Please welcome His Excellency Antonio Costa, President of the European Council, to the stage.
Distinguished heads of state and government, President of African Union, dear Ursula, dear Carlos Manuel Durão Barroso, dear Bill Gates, dear Sania Nista, Excellencies, ladies and gentlemen. First of all, I would like to thank Gavi for their work to promote health in the global world, and to thank Gates Foundation to be co-host of this event today. It is with a great pleasure and a true sense of commitment that I'm here today. A commitment to demonstrate the European Union's role as a reliable partner to global health, and the common goods demand common action. A commitment to health as a fundamental right, leaving no one behind, and standing up for more social justice, more global stability. A commitment to effective international cooperation and multilateralism between international organizations, governments, donors, private sector, and civil society. And a commitment to science and research as the only way to save millions of lives threatened by deadly diseases, endangered by obscurantism, negationism, and populism. A healthier world is a safer world. A more equitable world is a more peaceful world. Investing into vaccines is one of the best investments in global peace we can make. Now is the time to expand our network of partners and donors, because in health no one is safe until everyone is safe. This is why Gavi is pivotal in today's circumstances, for preventing new disease, for strengthening health system, for reinforcing social cohesion and political stability around the world. Through Gavi, the European Union has helped immunize over 1 billion children and prevented more than 17 million future deaths. That's multilateralism in action, a force for good in the world. Through Gavi, Team Europe is pledging close, as Ursula von der Leyen has announced, 2 billion euros between the European Union and member states combined. And our commitment will continue. We can go further. Gavi can always count on the European Union for stability, peace, multilateralism, and health security, making the next generation the most protected ever. Dear friends, thanks to all of you. Gavi is one of the great success stories of our time. The world needs more such success stories, not less. The world needs more empathy and solidarity, not less. Today's summit sends this strong message to the world. Together, we make the difference in people's lives. As co-host of this summit, I laud your strong commitment to this global cause. It is also European Union's cause. Thank you very much.
And now, taking to the stage, Bill Gates, chair of the Gates Foundation.
Good evening, and thank you for everyone joining us here tonight, and for all your support for one of the most transformative efforts in the world. I want to particularly thank President von der Leyen and President Costa and the European Union for co-hosting this summit. President von der Leyen has long been an incredible champion for health and development, and the EU has been one of the Gavi's biggest supporters since the very beginning. Support that's more crucial now than ever. This chart is one that I think about a lot. It's really my most favorite chart. You know, I consider it almost kind of a report card for humanity, because over the last 25 years, the reduction of under 5 deaths has been far faster than any time in history. We've gone from over 9 million to now half as many deaths taking place by children. This is an unbelievable result, and it doesn't fully state the benefit of these vaccines. The vaccines leave a lot of kids far more healthy, and so their ability to achieve their potential is increased. Gavi prioritizes saving lives, and it's done with incredible scientific rigor. We're constantly improving vaccines, we're constantly looking at the safety, and I'm very proud of the work that's done to make sure that these vaccines are incredibly safe. The founding of Gavi actually goes back to almost about the time the Gates Foundation was first started. And after 25 years, I can still say that it's at the top of the list of things that I'm very, very proud of. At that time, kids were not getting access to vaccines. They were too expensive, they hadn't been formulated properly, and I was stunned to learn that so many kids were dying from a disease like rotavirus because the vaccine wasn't getting out to all the children of the world. So Gavi was created to not only help finance vaccines, but work with countries to adopt these new vaccines. We've done an amazing job of getting these prices down. A good example is the pneumococcal vaccine, PCV. This vaccine became available in high-income countries the year that Gavi was founded. And it does a fantastic job of protecting kids against pneumonia, which was the single most deadly childhood infection. But it was very expensive. And so Gavi and its partners incentivized vaccine manufacturers to develop a new, much cheaper PCV, which was introduced in 2017. Today, the manufacturers make PCV vaccines available to low and middle-income countries for just $2 a dose. And of course, we've seen similar reductions across all of the different vaccines, allowing us to add new vaccines to save even more children. Since the founding of Gavi, the overall cost of fully vaccinating a child has been cut in more than half. And we have a pipeline of new vaccines coming along, vaccines to address new diseases and that bring down costs even further. A good example of this is the HPV vaccine. Cervical cancer, which HPV prevents, is the fourth most common cancer in women around the world. And this vaccine can prevent over 90% of these cases. But countries were slow to adopt this vaccine, in part because it was hard to deliver. Initially, it required 3 doses spread across 6 months. Scientists believed that perhaps it could be done with fewer doses. And so the Gates Foundation funded a trial to see whether a single dose was essentially fully protective. And after seeing the incredible results, the WHO approved a single-dose schedule in 2022. Now we have 75 countries around the world have moved to this single-dose approach. And because the single dose is cheaper and easier to deliver, it's now getting to far more girls around the world. For example, after Nigeria introduced the single-dose vaccine, it was able to vaccinate more than 12 million girls in less than a year. That's really incredible. Across Gavi countries, HPV vaccine coverage has increased dramatically. The year after this single-dose approval, we doubled the number of girls getting the vaccine, and we doubled it again, and this year we'll double it again. Of course, there's more than just making vaccines available. We have to work with our partner countries on helping improve their health systems. So the Gavi Alliance has spent a lot of its resources and a lot of its technical support in helping improve those primary health care systems that are so vital. We've helped countries understand where they're missing kids and how to invest in raising those coverage levels. As you've heard, over this 25-year period, that means over 1 billion children have been vaccinated, resulting in the saving of over 19 million lives. 19 million is a big number. It's almost easier to understand if I just say, okay, here's a child whose life was saved. But you have to take your reaction to how valuable that is and multiply it by this absolutely gigantic number. The total cost to save those lives was about $22 billion. And that means that Gavi saved children's lives for only about $1,000 per life saved. And this is in addition, the kids who these vaccines have kept healthy not only go to school, they do well in school, they join the economy, they contribute to their country. And really, this is why improving health through vaccines is part of the formula of helping countries be self-sufficient. Gavi's vaccination has generated $250 billion in economic benefits in the countries it supports. In fact, Gavi has had such an extraordinary economic benefit that over 19 countries that were Gavi recipients have now graduated, meaning they now fully fund their own immunization programs. A great example is Indonesia. Since partnering with Gavi, it's doubled the number of vaccines offered through its routine immunization program. And it's seen childhood deaths fall to a quarter of what they were before. And now, Indonesia has not only transitioned to be fully self-supportive, it's also become a Gavi donor. Of course, this is a challenging time. All the progress we've made is at risk. Budgets are tight, and we all have to show our priorities when there's tough trade-offs to be made. There's no denying this is a global health crisis. The US cuts and other funding cuts, aid in total has gone down by $30 billion this year alone. It reinforces the incredible values being shown by the people who are showing up here today and being incredibly generous. But with the cut in health resources, along with the financial situation a lot of these low-income countries are in, we are going to have a few years where things will go backwards. As we think about this, think of a mother who will bring a baby wheezing for breath to a health center, and because the vaccines aren't available, that baby will not survive. Think of a health worker trying to deal with a measles outbreak, who, because there's less resources for that primary healthcare system, our vaccines, that measles epidemic will continue. This is agonizing. I mean, we have to put ourselves in the position of the parents who lose these children, and how tough it must be for them to realize that the life could have been saved by a vaccine that costs just 30 cents. So, our trend lines will briefly go into reverse. I believe that we can come back. I believe that we will resume that incredible progress that you saw. I don't know if it'll be in 2 years or 4 years or 6 years, but I do know that as we bring these resources back and we take advantage of an incredible pipeline of innovation, new drugs, new vaccines, lots of amazing things to help with these diseases, we will resume progress. So everyone here, I'd say, is recommitting themselves, just like the Gates Foundation, to doubling down and staying committed. I'm not pessimistic. In fact, we have things like polio eradication that we are, as we say, this close to elimination. That'll be a mind-blowing thing. Likewise, malaria, we have tools, a variety of tools that brought together will give us a chance in the next 20 years to completely eradicate that as a disease, just like we're doing with polio. This is all why the Gates Foundation is pledging $1.6 billion to Gavi for this next 5-year period. Thank you. And it's why we'll invest billions in making sure that pipeline of new and lower cost vaccines continues to make Gavi even more effective. In closing, I think we can reflect on what Nelson Mandela once said. There can be no keener revelation of a society's soul than the way it treats its children. In the last 25 years, Gavi has helped over 1 billion children live better, healthier lives, thanks to the extraordinary support of partners like you. And if we get this right, this trajectory of progress will continue for decades to come. Thank you.
Please welcome Dr. Sania Nishtha, CEO of Gavi, to the stage.
Honorable Presidents and Prime Ministers, Ministers, Excellencies, ladies and gentlemen, thank you for joining us today to help us write the next chapter in Gavi's history. What you announce today will change the future of millions. It will determine how many of the 500 million children we plan to vaccinate over the next 5 years live or die. Before we hear from you, I'd like to make 3 quick points. As a starting point, you should be very, very proud. You made history by creating a uniquely impactful organization. There was a time when hospitals were crammed with sick children and graveyards were full of small graves and small coffins were commonplace. But you changed that. You created Gavi. You helped vaccinate a whole generation. 6 out of 10 babies born today are vaccinated by Gavi. What you have established is the pinnacle of what public-private collaboration can achieve. A system that delivers the best public health at scale. With its footprints in every corner of the world. Today, there are parts of the world without internet and cell phone connectivity, without water and sanitation, where there are no paved roads. But even in those remote areas, there is one thing functioning: ice boxes with vaccines inside. Health workers who traverse rivers, mountains, and deserts to deliver them, and women lining up with their children to receive vaccines. You should be very proud because vaccination is the only intervention where the development community has achieved anywhere close to equity. And this brings me to my second point, which relates to today's context, which is threatening progress. Our ability to protect communities from diseases and safeguard the world against the next pandemic threat depends on your support. Health security, which is an important component of national security, also depends on your support. Your support will not only save 500 million lives, you will also join us in a radical transformation of Gavi and the global health architecture. And this is what my final point is about: the Gavi Leap, which is our roadmap for reform. It can change the future of immunization, and its principles, we believe, can pave the way to transform global health. It places countries, not organizations, at the center of global health. It forges true partnerships with countries towards self-reliance. It focuses on our core strengths and comparative advantage. We are, Excellencies, ladies and gentlemen, adapting to the challenges of today, and we are willing to play a part in helping renew global health for the challenges of tomorrow. On behalf of Gavi, the Vaccine Alliance, I want to thank you all again for supporting our mission, even in times when you face many other challenges. I want to thank you for every commitment you're about to make and for every life you're about to change. Good luck, and let us make history today. And now, it is my great honor to welcome His Excellency President João Lourenço, President of the Republic of Angola and the current chair of the African Union. We are deeply grateful for his leadership and for taking the time to join us today. Mr. President, I'm pleased to turn the floor over to you.
Excelências, chefes de Estado e do Governo.
Your Excellencies, Heads of State and Government, Mr. José Manuel Andrão Barroso from the Global Alliance of Vaccines, Gavi, dear partners and guests, Mrs. President of the European Commission, Ursula von der Leyen, ladies and gentlemen. It's with great pleasure that I address myself to you as President of the Republic of Angola, but also President of the African Union, in a critical moment when the world is once again deciding if it will be up to its responsibilities, which is protect lives and save lives of our children, and start by thanking Gavi, to its president, José Manuel Durão Barroso, its president, for the invitation to address you here today and to renew our engagement of global solidarity, which overcomes borders and political cycles, with a promise that no child nowhere in the world will be left behind when it comes to access to vaccines which save lives. Your Excellencies, the world is facing uncertainty with wars, with armed conflicts, with geopolitical instability, trade instabilities, climate change, pandemics, economic crisis, and pressuring, of course, the health systems around the world. Despite all these and all these challenges and threats to human lives, there is a truth, which is that vaccines are still one of the most simple and most efficient tools and less costly that humanity has created in order to defend and create life. It prevents diseases that used to kill our populations, protect our children in its first days of after they're born, giving them a chance to grow, study, dream, and give their own contribution for the development of its nations. More than that, vaccines represent hope. They represent the right to health, to infants, to a future. As we all know, vaccines are powerful tools of just social justice and economic development of our countries. We are certain that we want more healthy societies, more productive societies, more prosperous societies, also thanks to vaccines. Protected by vaccines, populations are more resilient, capable to face sanitary crisis, more apt to contribute to the development of their respective nations. And as Africans, we are united. And we are convinced that immunization is a powerful tool, and it's a tool to our development. Your Excellencies, it's important now to recall that thanks to vaccines, poliomyelitis is almost eliminated and variola is also being eradicated. Diseases like chickenpox, rubella, meningitis, tetanus, yellow fever, and others, and COVID-19, to name a few, have been under control, saving millions of lives around the world, in particular in Africa. It's not just health we are referring to, but also human development, social stability, and economic growth. One healthy child learns better, becomes a productive adult, contributes for the development and social peace. And these are the reasons why investing in vaccines is investing in the future of our societies. These are the reasons we are convinced and that immunization should go on being a continental priority, but also world priority. Your Excellencies, in the last 25 years, the Global Alliance for Vaccines has been a strategic partner, trustworthy, a multilateral tool, and a symbol of international solidarity, well succeeded. With an approach based on evidence, results, and equity, Gavi has allowed, and more than 25 low-income African countries have been amplified their access to vaccines, in particular new vaccines, which in other manner would not be accessible to millions of children of this continent. On the other hand, we have to acknowledge the efforts of Gavi in order to adapt its financial support models, including the work for the countries who average income to have access to different kinds of funding. This is a crucial step in order to guarantee that no child in the world is left behind, even in the context of economic transition. In 2021, or between 2021 and 2025, Gavi has channeled more than $5 billion to the African continent, which is the equivalent of more than $1 billion per year. In 2023 alone, more than $700 million were invested in Africa. The impact is clear and transformative. Countries such as Angola have benefited of these supports, and I should underline the introduction of 7 new vaccines, including those who protect us to 2 of the main causes of death in children with less than 5 years, pneumonia and viral diarrhea. And soon we'll introduce a new vaccine against papillomavirus human in order to guarantee a healthy life to our youth, but also intend to introduce malaria vaccine, which is the first cause of death in our country and continent. And of course, significant advances recovering of children 0 to 12 and the answer to poliomyelitis, COVID-19, chickenpox and cholera, but also reinforcement of the health system, the new cold chains that have been installed with the help of solar panels. So the introduction of these equipments represent strategic advances to disseminate the vaccines in remote areas, to preserve and conserve the vaccines, but also contributes for the reduction of emissions of CO2, promoting health systems which are more sustainable and aligned with the global climate objectives. The digitalization has also helped us managing vaccines and essential health products. This partnership has not only saved lives, but also improved the confidence of the population in the national health services. We also acknowledge the efficiency of any system does not depend only in vaccines or equipment, but also on skilled professionals. In Angola, but also in other African countries, we've been training with the help of Gavi, epidemiologists, logistic technicians, data managers, and other professionals in order to ensure the good implementation of the immunization program. Investing in the training of these professionals is investing on the sanitary sovereignty. And in this sense, we have started a new program of specialization of 38,000 professionals in different critical areas, in particular in health care, primary health care, which are a pillar of public health for the next decades. Today, Gavi needs us. The targets are ambitious. We need to mobilize $9 billion for the period 2026-2030. And with this funding, it will be possible that Gavi supports the vaccination of 500 million children and saves between 8 to 9 million lives. Your Excellencies, it's not just an investment. It's above all a strategic decision, a moral duty, a pact for the next generations. Each dollar that we mobilize today transforms into concrete hope for millions of families, produces future costs that we can avoid, and improves our health systems and promotes our economic economies of our country. We are engaged with the cause, and we ask the international community to engage itself, because vaccinate one child is not just protect one life, it's to protect the future through sanitary safety at the global level. As President of the African Union, I bring to you today this message. Africa is not just beneficiary. Africa is ready to be co-author of the new era of global immunization. We want more equity, more voice, more autonomy. COVID-19 pandemic exposed the dependence of our continent to the external chains of vaccine production, and we cannot stay in that situation. We have to change it. This is the reason why we support Gavi's initiative in order to enhance the regional production of vaccines, and the framework of the initiative, ADMA, African Vaccine Accelerator. And looking ahead of the global vaccination system, we believe that Gavi can also play a strategic role supporting the introduction of new vaccines, especially against diseases which affect disproportionately African countries and more vulnerable populations at the global level, as tuberculosis, malaria, and dengue. Innovation should be move together with equity. Africa is ready to be an active partner in research and implementation of these solutions of next generation. We want transfer of technology, bilateral partnerships, more capacity for our health, accessible and cheap vaccines for all Africans, but also to the rest of the world. African youth is one of the biggest hope reserves of humanity. More than 60% of the African population is less than 25 years old. As the world is looking for solutions to deal with global aging, Africa represents a source of the human dynamics, creativity, and a productive ability. These are the reasons why Africa, especially Angola, makes vaccination as a strategic pillar. And we are looking for a prosperous future based on our youth, on health, education, and participation of the economic and social life. Your Excellencies, this summit represents a unique opportunity in order to promote just, fair funding, transformative funding. Opportunity for us to show that even through hard times, global solidarity remains unshakable. And on behalf of the African people, on behalf of the Angolan people and all the children who deserve a healthy life and dignity, engage ourselves with Gavi. And sustainability of the global immunization is at play. History will recall those who have raised today in order to make the difference. Let's act with guts, lead with vision, investing in life. History will certainly judge us, not only for what we said, but certainly more for what we decided to do or not to do together for humanity. And with these words, I conclude thanking your attention. Thank you very much.
Obrigada, Senhor Presidente. Thank you so much indeed, Your Excellency, President of Angola, ladies and gentlemen, and also the Chair of the African Union, His Excellency João Lorenzo. Thank you so much. Your words and your leadership, they truly echo the shared responsibility that we all have in this room and the opportunity that we must seize. Ladies and gentlemen, we change gears now. Please join me in welcoming two extraordinary individuals whose voices have mobilized millions Hugh Evans, co-founder and CEO of Global Citizen, and 5-time Grammy Award winner Angelique Kidjo. Welcome.
Over 1 billion children, that's an entire generation, have been protected against infectious disease by the work of Gavi, aided by so many here tonight.
And Global Citizen has been proud to support the work of Gavi for over a decade with our shared goal of helping children in the most marginalized communities survive and live healthy lives. Investing in vaccines is the backbone of good health policy and is essential to lifting people out of extreme poverty. We know that diseases don't respect sovereign borders. Supporting this replenishment is the best way to prevent the next public health crisis, to keep all of us healthy and safe, and we commend the leadership of the countries, businesses, and philanthropists who are pledging their support tonight.
With 14.5 million zero-dose children still totally unprotected from infectious disease, and as the world grapples with conflict, climate change, and geopolitical instability, Global Citizen, as well as all the dedicated public and private partners in this room, have stood with Gavi once again. Over the past years, we have mobilized citizens, advocates to governments, and accelerate access to life-saving vaccine in the countries that need them the most, so that no child is left behind. Let us not let that progress go away. We are here today to commit to prevent our children to die from preventable disease. And as a goodwill ambassador, I'm asking you, with Gavi and the Global Citizen, to continue working together to save our children.
And we know that financial and political commitments like those you'll hear from the stage tonight are absolutely essential to protect and transform another generation of the world's most vulnerable children. From projections onto the biggest sites in London, Paris, and Berlin, to a full-page ad yesterday in Norway's largest newspaper, Global Citizens have been calling on governments around the world to step up and protect more children against more diseases and protect our world from the threat of pandemics. And we are proud that the actions of 12 million global citizens around the world help drive early commitments from the European Commission, Croatia, Portugal, and my home country of Australia, who just announced its largest ever commitment to Gavi. And we are excited once again to partner with you, President von der Leyen, and to applaud the leadership of you and President Costa for hosting this vital replenishment. Thank you.
With Gavi leading the way, supported by global citizens around the world, together we will defeat infectious disease, give every child a shot at life, unleash economic benefits for healthy communities, and bring us closer to ending extreme poverty. This is the opportunity of a generation. The future of our children depends on it. Let's work for our children, please.
Please turn your attention now to the screen for a special address by the Secretary General of the United Nations, Antonio Guterres.
Excellencies, distinguished guests, I thank the European Union, the Gates Foundation and Gavi, the Vaccine Alliance, for convening this crucial summit. Over the past 50 years, vaccines have saved over 150 million lives. Every dollar invested yields $54 in benefits. Gavi and its partners are the backbone of this success, but the work is far from done. Protecting 500 million more children by 2030 requires an urgent investment of at least $9 billion. Strong immunization programs are our frontline defense against infectious diseases and the foundation of resilient societies and economies. At a time when vaccine hesitancy and misinformation are spreading like wildfire, this investment is more crucial than ever, especially as other support is being rolled back. Today, I urge leaders across all sectors to act with generosity and resolve. Let's invest in immunization for the health and prosperity of all, and I thank you.
Thank you so much. Now, we know that the ambition of this replenishment is bold, but so is the leadership standing in solidarity to meet the moment.
Absolutely, Nzinga. And next we'll hear from the distinguished leaders of Spain, Ireland, Greece, Portugal, Croatia, Malta, and the United Kingdom, plus France and Luxembourg. But first, it gives me great pleasure to welcome His Excellency Pedro Sánchez, President of the Government of Spain. Damos la bienvenida al señor Presidente del Gobierno de España. Señor Presidente, usted tiene la palabra.
Presidenta, Presidente.
Dear Presidencies, Excellencies, ladies and gentlemen, we usually say that the future is conquering modernity, and it is the trust in knowledge, science, and everything we have learned over generations that has allowed humanity to look beyond and to get away from the constraints of present times. I think this summit gives us an opportunity to look ahead. Right now, we are seeing how the geopolitical situations are rapidly changing and usually not in the direction we would like. We can see how international communities are being weakened, armed conflicts are arising everywhere, and health crises are affecting the most vulnerable. This comes hand in hand with people questioning international order. That is why today, more than ever, it is necessary to take a step forward. And we need to make sure that the citizens trust international institutions, because we can respond to common challenges. In Spain, we like to lead by example. We are committed to the multilateral system and to the international health system. Our commitment lays within two pillars. First of all, the Spanish people believe vaccination is a key element to prevent disease. And the second pillar is that vaccination is the most effective tool to eliminate diseases alongside drinking water and sanitation. That is why we are committed, and we would like to open the benefits of vaccination to people all over the world. The Gavi initiative is one we salute. We have also given in 2020, during the pandemics, the Princess of Asturias Award to this association. So I would like once again to commend the work of this association. Over 1 billion children have been vaccinated thanks to the vaccinations program, thanks to the support of the implementation countries, and also they have prevented millions of cases in preventable diseases. That is why Spain is ready to take a step forward when others are backing down. That is why we are doubling down our investment in health and also in immunization and vaccines. That is why I am committed today. I am pledging to raise 30% of the funding. We will be pledging 130 million euros for the period 2023-2030. I would like to be brief because we have many distinguished speakers, but as you know, in Spain we will be hosting the 4th conference for development, for financing development, and this will be taking place in Seville. We will have a platform called Seville for Action, and we will be presenting high-impact initiatives. I am extending you a warm welcome to this summit. I hope we will have experts, health authorities, cooperation experts from all over the world, so we can have fruitful debates and we can create a common roadmap. I think together we must work and we need to push for international governance and health. Thank you.
Ladies and gentlemen, time now to welcome to the stage His Excellency Luis Montenegro, Prime Minister of Portugal.
Excellencies, ladies and gentlemen, a first word of sincere recognition to the Vaccine Alliance for its commitment to global health and for the promotion of universal access to life-saving immunization. Gavi has been responsible for immunization hundreds of millions of children and preventing millions of deaths and from preventable diseases. This solid commitment with the most vulnerable populations across the world is even more relevant on a global context marked by uncertainty and instability. This work is vital and deserves our broad and bold support. The government of Portugal has recently announced more €2.5 million contribution to the Global Alliance for Vaccines and Immunization for the next 5-year strategic period. This contribution represents a significant reinforcement of Portugal's commitment to the advancement of global health. By contributing to reinforcing vaccination programs, notably in Portugal-speaking African countries, the Portuguese government aims to promote broader immunization coverage, disease prevention, and stronger health systems. Portugal remains firmly committed to the principles of the multilateralism and believes no one should be left behind. We strongly value Gavi as a key multilateral partner and a vital pillar of global health architecture. Count on us to continue helping those vulnerable countries to build stronger, more resilient health systems. Our cooperation with Gavi represents not only a shared investment in public health, but also a powerful expression of global solidarity. By promoting global health, we are also promoting the best of ourselves, caring for each other within one big human family. We will remain committed to this effort, and we commend all those who are joining us in this common endeavor. Thank you so much for your attention. Muito obrigado, José Manuel Durão Barroso.
Ladies and gentlemen, please join me in welcoming His Excellency the Taoiseach of Ireland, Michael Martin.
Good evening, and I'm very honoured to join you all today at this pledging summit to affirm Ireland's deep and sustained commitment to global health equity. Vaccines have utterly transformed health outcomes across the world, and evidence from the World Health Organization shows that vaccination is one of the best health investments that money can buy and one of the most impactful tools available to us. However, as we look around the world, the reality is that inequalities in healthcare and access persist. Globally, health systems are struggling to keep pace with levels of need. In some humanitarian situations, health systems are even under attack. we must simply do more. We must protect essential health services. We must ensure those in crisis settings have access to healthcare, including immunisation. We must ensure that children are not dying from preventable diseases. No one should be left behind. Ireland's foreign policy and our development cooperation is fundamentally guided by the principle of reaching the furthest behind first. Vulnerable children who have not received any routine vaccinations are front and centre of our focus. Gavi is without doubt a fundamental, strategic, relevant, effective, impactful partner in the global effort to protect and secure health and well-being for all. So on behalf of the Irish people, I'm today happy to confirm a pledge of 22 million for Gavi's work to deliver health and prosperity through immunisation. This is a 20% increase on our previous pledge and demonstrates Ireland's commitment not just to Gavi, but to global health equity, solidarity and multilateralism. Overall, Ireland is committed to providing support that is both predictable and flexible, and to maintaining our overseas development assistance priorities, focused on ending poverty and working in solidarity to achieve these sustainable development goals. Thank you very much indeed.
Ladies and gentlemen, please join me in welcoming the Right Honourable David Lammy, Secretary of State for Foreign, Commonwealth and Development Affairs of the United Kingdom of Great Britain and Northern Ireland.
Well, it's wonderful to be here after such a challenging week globally. What a hopeful room to be in. I was reflecting that 25 years ago this week, I entered the UK Parliament for the first time, becoming a Member of Parliament, bright and confident and hopeful, and eager to make a difference. And what an example of making a difference than Britain and others coming together to form Gavi that year that I was elected. Every second child born today gets a Gavi-supported vaccine, protected from deadly diseases, and investment in their potential against a difficult fiscal backdrop we know. Of course, we will need a modernized approach to development and aid, investors, not donors, looking to secure the biggest return that we can. And that does mean doing things differently. But it also means recognizing what we have done well and looking to do them even better. And that's what we're doing today. And that's why I am so proud that the United Kingdom will be the single biggest country donor, investing $1.25 billion in Gavi. My friends, where others are stepping back, we in the United Kingdom are stepping up. This will help immunize over 60 million children, saving 1.25 million lives. It will strengthen new markets, with every pound of investment in Gavi driving an incredible £54 in wider economic benefits in the countries involved. And it will foster expertise at leading British pharma, firms like GSK, of course, and it will reduce the chances of killer outbreaks such as Ebola or cholera reaching Europe. This is a smart investment, and we are making it go further than ever before, using capital markets and attracting innovative private sector investment through Gavi's matching fund. But to reap the full rewards of this investment, we need to reform the global health architecture. Institutions have multiplied, more and more work is siloed off, transaction costs have risen, and national health systems have been disempowered. I want to echo Dr. Sania Nishtar's ambitious vision for Gavi. Bodies like Gavi need a broader base of supporters, a simpler approach to delivery that puts country ownership at the heart of the model. Today we can see when people said, why has the developed Western world failed to vaccinate Africa against the COVID pandemic? That was an important question. But another important question was why, at that point, had we failed to give Africa and support Africa to have its own manufacturing capability? We're changing that. Countries like Indonesia have joined India in moving from receiving Gavi support to giving Gavi support. Gavi has committed to working more closely with the Global Fund and Global Partnership for Polio Eradication, are the key partners, of course, in this very crowded space. And several countries have committed to increasing co-financing for vaccines and invest more in their health sectors. But we all know that we will need to go a lot further, working together, and crucially, implementing more in countries. Let's get this system primed to make the most of our investments. God bless you. Thank you very much indeed.
Ladies and gentlemen, please join me in welcoming to the stage His Excellency Kyriakos Mitsotakis, Prime Minister of the Hellenic Republic.
Madam and Mr. President, Excellencies, ladies and gentlemen, allow me to not use my prepared remarks because I don't want to repeat what has already been said by very eloquent speakers before me. Let me just share with you a deeply personal story. My late mother contacted polio during the Second World War. And she received the best possible care. She lived a fulfilling but very difficult and challenging life. And she was one of the lucky ones. That's how many other children did not have such a future. And as I was listening to Mr. Gates speaking about polio eradication, I was thinking of the tremendous progress that science has made over the past 50 years. And I was also thinking about the tremendous contribution that Gavi has made as a model private-public partnership, delivering vaccines to tens of millions of children saving millions of lives. And I believe that it is our duty, our contribution, to make sure that this work continues at a time when leading donors are stepping back, but also at a time when vaccine skepticism is rising across the world. And I'm very happy and honored that Europe, Team Europe, is stepping up to make up for the funding gap that has resulted from the decision of other leading donors not to continue with funding Gavi. So on behalf of the Greek people, I would like to announce that the initial recommendation by my Minister of Finance was to contribute 2 million euros to the Gavi cause, but I've decided to increase that to 5 million. And I've done so, and I was thinking that some of us came back from the NATO summit in order to make sure that we are with you here today to reconfirm our support to Gavi. And I was thinking that if we can afford, and rightly so I may add, to spend 5% of our GDP on defense over the next years, Greece certainly can afford to contribute 5 billion to Gavi. Thank you very much.
Ladies and gentlemen, please join me in welcoming on stage Andrej Plenković, Prime Minister of Croatia.
Good evening, ladies and gentlemen, Excellencies, Madam President of the Commission, President of the European Council, dear João Manuel, dear Mr. Gates, Excellencies, leaders, since the major points of my speech, which I was supposed to give, was really so nicely said by all the previous speakers, I will try to summarize it in this way. When I met José Manuel in Munich, he wanted Croatia to become part of the core donors of Gavi, which I immediately supported, and we have extended our solidarity during the COVID crisis by donating more than 3.5 million worth of vaccines to our neighbors, but also globally. I asked him, tell me, dear friend, how much do you expect from Croatia? He says, 1 million. I said, okay. He said, I should have said 2. So my point today is that it is true. Croatia will commit 1 million for 2025, but we shall commit 1 million throughout the period of 2030. So it's not 2, but it's 6. Thank you very much. Honored to be with you.
Please join me in welcoming on stage His Excellency Dr. Robert Abela, Prime Minister of Malta.
Good evening to all distinguished guests, Excellencies, dear friends. We are all gathered here today for the same reason. We live in a world where a vaccine can be developed in record time, yet still takes far too long to reach the children that are most at risk. The barrier is no longer the science, it is access. Closing this gap is our shared responsibility. At a time of deepening geopolitical uncertainty, which only widens inequality, this mission is now more relevant and important than ever. I want to begin by thanking the European Commission and the Bill and Melinda Gates Foundation for bringing us here together, and by recognizing Gavi's extraordinary work over the past 25 years. You have managed to change the future of millions of children. and you continue to strengthen the systems that hold up global health. Equitable access to healthcare and medicines, regardless of where somebody lives, is something that I care deeply about. It is a value that Malta, my country, shares, and one that lies at the heart of Gavi's mission. This was put into sharp focus during the COVID-19 pandemic. The tireless leadership shown by Gavi, alongside the public and private sectors, helped secure worldwide access to the vaccines, making it possible for the world to begin recovering together from an unprecedented crisis. And yet, barely 5 years on, it is clear that much more remains to be done. While overall progress remains encouraging, as mentioned by Mr. Bill Gates before me, with fewer children dying before their 5th birthday than ever before, many people, including the most vulnerable, still lack access to basic vaccines and essential vaccines. This is especially true in communities where health systems are under strain or where access is more difficult, whether due to geography, capacity, or conflict. We have seen the evidence. Vaccines save lives, reduce inequality, protect economies, and strengthen resilience. But their impact depends on strong systems, trained healthcare workers, reliable supply chains, and trust in communities. Most of all, it is about reaching each and every community. Most healthier societies, more resilient systems, and greater preparedness for future health threats across communities, across borders, and across generations. That is what our cooperation can achieve. Gavi, working together with the other key health actors in the international system, plays a vital role in closing the global immunization gap by supporting countries to strengthen delivery, expand access to vaccines, and respond to outbreaks. Gavi helps ensure that life-saving protection reaches those who need it most. This work has been critical in the fight against some of the world's most deadly but preventable diseases like measles, polio, and HPV, and in building the long-term infrastructure that global health depends upon. The goal of global health and prosperity is, however, not Gavi's alone to deliver, nor the private sectors. It is a shared responsibility. Gavi is a key partner in this effort, but real progress demands broad and sustained support, political, financial, and practical. Gavi is doing its part for sure. Those of us in a position to contribute must do ours. For these reasons, I am pleased to announce our multi-year financial commitment to Gavi. This contribution reflects our support for its mission to ensure that the most vulnerable have access to life-saving vaccines. We are determined, in the spirit of solidarity, to ensure that nobody is left behind. Thank you.
Ladies and gentlemen, please join me in welcoming on stage His Excellency Yannick Nouda, Minister of Social Affairs and Health of France.
Bonsoir à tous, Monsieur le Président.
Good evening, all. President of the European Council, President of the European Commission, Chair of the Gavi Board. and CEO of Gavi, Chair of the Gates Foundation. Ladies and gentlemen, good evening to all. On behalf of France, please allow me to congratulate and warmly thank our co-hosts for having organized this event. France is proud to be one of the historic donors of Gavi. 5 years ago already, we reaffirmed our support to the alliance in a particularly difficult period, right in the midst of the COVID crisis, to assist Gavi in mobilizing resources in a situation of crisis. In 2023, Gavi reached over 1 billion children immunized. Today, we meet again to look back over the last 5 years and to provide Gavi with the means it needs to accelerate its impact in the coming years, which will also be the realization of the SDGs by 2030. As you know, France was delighted to host a special meeting in Paris during the Global Summit on Immunization in June 2024. Messages of equity, of sovereignty, and others had been heard loud and clear in the speeches made by heads of state and government that day. Thanks to the generosity of the donors, this event already allowed for the mobilization of over $2.4 billion, and it placed the alliance in a very good place before its replenishment. The President of the Republic, President Macron, announced back then that we would renew our commitment to Gavi for the 2026-2030 cycle, at least at a similar level to our previous one. Today, I'm delighted to inform you that we will contribute to the future cycle by 500 million euros. This contribution will allow the alliance to vaccinate 500 million additional children and save millions of lives by 2030. It will allow for the acceleration of vaccine coverage in the poorest countries, in particular in French-speaking Africa, and will allow thus for the protection of all of our citizens. France supports immunization. We are the country of Pasteur, and we want to fight against obscurantism in the European Union in particular. Our contribution to Gavi will also allow for a strengthening of local and regional capacities. I'm thinking in particular of AVMA, the African Vaccine Manufacturing Accelerator, co-financed by the African Union and the African Union a couple of years ago, and this will allow for work to be carried out in cooperation with the private sector. I welcome all those who've supported the African agenda of vaccine sovereignty, and I would like to encourage these players to go even further in the spirit of the global agreement on pandemics, which has just been adopted by the member states of the World Health Organization, and to continue the practice of evidence-based medicine and combat fake news. This year, Gavi is celebrating its quarter century, and the success of the alliance will also depend on its ability to work with other players of global health. I would like to call on all multilateral institutions, including development banks, to come together and strengthen their cooperation. And I would like to seize the opportunity that is given to me to welcome the implementation partners who've constantly increased their co-funding shares to Gavi over the last few years. Mobilizing more national resources is a key to heightened sovereignty. But our journey does not stop here in Brussels. We have a long journey ahead of us in a very difficult situation, but the COVID-19 crisis proved to us that we're capable of taking on the harshest challenges together, and it is together that we'll continue to go further and faster. Thank you for your attention.
Ladies and gentlemen, please join me in welcoming Her Excellency Ms. Reem Alabali Radovan, Federal Minister for Economic Cooperation and Development from Germany.
Excellencies, honored guests and partners. What Gavi has done so far is not just impressive, it's historic. The Alliance has vaccinated over 1 billion children worldwide. Gavi shows what's possible when governments, international organizations, the scientific community, businesses, and civil society works together. And that's exactly what our world needs to see, now more than ever. Strategic alliances and more health equality in action. For that, I would like to thank Gavi wholeheartedly. The success of Gavi means that fewer children die, more children can go to school, and more children have the chance of a healthy and productive future. All of this made possible through partnerships. Partnerships based on the needs of the Global South. Partnerships that put those countries in the driver's seat. We cannot stop here, however. The coming years will be critical. New viruses with a pandemic potential, climate change, conflicts, and disengagement of important development financiers, all of these threatens the progress we've made through vaccination. We would be ill-advised not to invest in Gavi. In times of shrinking spaces and reduced public budgets, investing in immunity is the most effective and crucial contribution we can make to protect us all. I am therefore proud to announce Germany's pledge of 600 million euros to help vaccinate. Thank you. To help vaccinate an additional 500 million children and save over 10 million of lives worldwide. Because health is a human right and vaccines are one of the most powerful tools for making that right a reality. Thank you.
Thank you so much, Excellencies. The incredible pledges we have heard tonight, the numbers and the statistics are so awe-inspiring. I think the quote that we heard earlier on that said, while others are stepping back, we are stepping up, really captures the spirit of all our partners, friends, and donors here tonight. Thank you so much. A final round of applause, please, for all the incredible pledges and numbers we heard earlier today. And now we will welcome the leaders of Sierra Leone, Ghana, and the Central African Republic. First up, please may I invite His Excellency Julius Maada Bio, the Chair of the Authority of ECOWAS and the President of Sierra Leone, to address us. Thank you.
Your Excellencies, distinguished delegates, fellow advocates, I bring you warm greetings from Sierra Leone on the West African coast. I'm from every corner of the world where the cry for health equity still rings out. It's an honor to join all of you at this very important summit where global leaders come together with a unified purpose. That is to protect the health and prosperity of future generations. Today, I assert one truth that we can no longer ignore. Health through immunization is a privilege. It's not a privilege, sorry. It's a right for us all. No child should be denied the protection that science provides. No parent should have to witness their child suffer from a preventable disease. Immunization is one of humanity's greatest public health achievements, yet its benefits are still not evenly distributed. When a child dies because of the lack of vaccine, they are denied opportunities for life, growth, and advancement. This is not only a failure of health systems, but also a failure of justice. In Sierra Leone, immunization is at the core of our national development agenda. It is how we safeguard the future, child by child, vaccine by vaccine. Over the years, we have significantly expanded access to life-saving vaccines. For instance, to protect our children, we have introduced the malaria vaccine and rolled out the human papilloma virus, HPV, vaccines for girls. Today, we are proud to maintain over 90% coverage of key childhood vaccines in Sierra Leone, one of the highest in the region. These achievements have led to significant impacts. Child mortality has decreased by more than half, and our communities are healthier, stronger, and more resilient. Behind every statistic lies a story. A child protected from disease, a family spared from grief, and a health worker empowered to serve. Yet, as we advance, new threats emerge. Earlier this year, Sierra Leone declared an mpox outbreak. Our response drew on hard-won lessons from Ebola and COVID-19 pandemic, emphasizing early detection, rapid coordination, and strong community engagement. We are once again reminded that establishing health security is an ongoing business and never truly finished. As global aid continues to change, Sierra Leone remains steadfast in its commitment. We are increasing domestic investment in healthcare, exploring innovative financing solutions, and remain committed to global partnerships. As we all know, no country or institution, no matter how determined, can accomplish this alone. As I conclude, honorable delegates, I applaud the importance of Gavi's new 5-year strategy, 6.0, which aims to increase access to vaccines and strengthen health systems in low-income countries, thereby improving equity in immunization delivery. I want to express my gratitude to our host, Gavi, the European Union, the Bill and Melinda Gates Foundation, for bringing us together at this all-important meeting. They have reaffirmed the important truth that immunization is not only a health issue, but also a foundation for equity, stability, and shared prosperity. We must therefore protect the gains we have made and push even further. No child should suffer or die because of where they are born, what their families earn, or the circumstances they did not choose. A healthy child is not only a sign of progress, it is a promise of the future. When we invest in healthcare, we invest in education, productivity, and peace. We break the cycle of poverty and open doors to possibility. I implore, therefore, everyone to reaffirm our commitment to building a world where every child has access to the full protection of immunization. A world where no mother has to beg for medicine and no father has to choose between food and healthcare treatment. Health is not a privilege for the fortunate. It is a right for everyone. And the promise of vaccines must reach every corner in every part of the world, and we should make sure that happens. Thank you all.
Thank you, Excellencies. Our next speaker is another one of Gavi's strong supporters and partners. A warm welcome, please, for the President of Ghana, His Excellency John Dramani Mahama, making his way to the stage now.
Thank you very much. In the interest of time, let me proceed on established protocol. Distinguished ladies and gentlemen, for me, the issue of vaccines is deeply personal. And that is because when I was growing up, one of my younger brothers was affected by polio. He was crippled. He lived with the stigma of his disability for many years. And eventually he was driven into depression and became an alcoholic. And he died from alcohol poisoning. I'm having to look after the 2 children he left behind. And so I understand what life-saving vaccines are. The rest of us who grew up healthy and are here today were the lucky ones. And we grew up in a period where access to vaccines was close to zero in our part of Africa. Today, Gavi has changed all that and given hope to millions of children. Across the world, many children are growing up to become responsible citizens of their communities because their lives were saved by Gavi's immunization. In Ghana, we're proud to be partners with Gavi, and I'm proud to say that in partnership with Gavi, Ghana has achieved 97% immunization coverage. But it means that another 3% is missing. And we're working hard to find those 65,000 children who are in remote areas that are difficult to reach. And I know that working with Gavi, we'll be able to find those children and also give them the life-saving vaccines. Ghana is a lower middle income country, and so our partnership with Gavi is one of co-finance. And I'm proud to say that over the recent years, we spent almost $67 million on vaccines in partnership with Gavi. One of my first decisions as president was to uncap our national health insurance. The previous government had put a cap on the statutory fund of the national health insurance. So excess funding above a certain percentage of the budget went back into the consolidated fund. By uncapping the national health insurance, we've been able to give the insurance fund more than 3.5 billion cedis more. And so this has enabled the health insurance fund that puts up the funding for our partnership with Gavi to be able to front load $20 million for our co-finance partnership with Gavi this year. So on behalf of the children, I want to say thank you to Gavi. We are hoping that we'll fast track our weaning of Gavi by 2030. We're supposed to go off Gavi funding by 2030. And it's my expectation that we'll work hard to be like Indonesia and in future become a donor country to Gavi. On behalf of the children of Ghana, I want to say thank you to Gavi. We appreciate and we're proud of your partnership. but more so to say thank you to the countries that have just made significant pledges to the replenishment of Gavi. And I'm taking back the slogan, while others step back, we step up. Thank you very much for what you're doing. But to conclude, let me put the Gavi replenishment in context. Gavi is seeking to spend $9 billion over the next 5 years, from 2026 to 2030. And that is to immunize 500 million children across the world. These children's life will be safe to grow up to become the scientists, engineers, nurses, teachers, and doctors of tomorrow. This morning, while I was lying in bed, I did the research. And I realized that one B-2 Spirit bomber that dropped bombs on Iran recently cost $2.13 billion. If you work the math, what Gavi is seeking is the value of 4 of those B-2 bombers. Surely the world can afford the value of 4 B-2 bombers to save 500 million children. It's a choice we have to make. It's a choice we have to make between taking lives and saving lives. And I'm sure that we will save lives instead of taking lives. And so, on behalf of the children of Ghana, I say thank you to Gavi. I say thank you to all who have pledged today. Thank you very much. God bless you.
Please welcome His Excellency Faustin Archange Touadera, President of the Central African Republic.
Excellences,
Excellencies, I'm Director of Gavi, ladies and gentlemen. I am very happy to take the floor in front of you on behalf of the Central African people. We really want to thank Gavi for vaccination and to reaffirm our commitment for universal vaccination. Since 2002, the Central African Republic is supported by Gavi. And with this alliance, we could introduce and provide essential vaccine against diphtheria, whooping cough, tetanus, hepatitis B, rubella, poliomyelitis, yellow fever, and most recently, malaria vaccine. So despite the challenges linked to safety in my country and despite the fragility of our sanitation system, Gavi remains an important partner and reliable partner, and the results are here showing that. In 2018, 48% of the children in South Africa were receiving the 3 doses of vaccine. In 2024, this rate reached 71%. This is an incredible progression in a difficult context. So, vaccine coverage against measles was 52% in 2016 to 76% in 2024, reducing the outbreak. Thanks to Gavi support, more than 1 million children have been vaccinated during the last 5 years, saving many lives and reinforcing our sanitary safety. Through this subvention, through these grants, Gavi allowed our country to have to deploy modern equipment for the cold chain in 80% of our structure, and this even in the most remote regions, offering an important part for our system. So the Central African Republic, with 43,000 first doses for the anti-malaria vaccine R21, with 120,000 doses that are being delivered, is one of the first countries in the world to use this vaccine within its routine vaccination program. So this vaccine will complement the prevention efforts and treatment efforts with the hope to save millions of lives each year. So the COVID-19 outbreak learned us a lesson, an essential lesson. Facing this huge crisis, no country is protected. Only the international solidarity allows to fight these huge sanitary problems and allows to improve the health of our citizens. And if the vaccination is deployed thanks to joint efforts allowed to end this outbreak and its consequences that have been felt everywhere, hopefully, Gavi, through the COVAX initiative, allowed to my country to have an equitable access to vaccine against COVID-19. Despite the progress that have been made, the needs are still there and are huge, while the world is going through uncertainties with the climate change that is threatening the populations, with also scarcing resources. But we have to act. In the Central African Republic, the context is not an obstacle for universal vaccination.
Thus, several innovations have been taking place to strengthen access to this immunization, with a focus on making communities responsible, eliminating inequalities related to gender, amongst others. We count on the technical and financial support of Gavi for these innovations to flourish. Supporting innovations through Gavi is not an option. It's a responsibility. It is a moral responsibility, a political one, and an economic one. Each dollar invested in Gavi is a step towards a more stable, fair, and safer world. A world where one child has the same chances of growing up and living a healthy life wherever he or she lives. The Central African Republic is convinced that we require sustainable and frank mobilization of resources for Gavi in the next 5 years. And in that spirit, I am delighted to announce that the Central African Republic is committed to making a contribution of $1 million for the next 5 years. Together, we must ensure that solidarity triumphs in favor of health for all. Thank you for your attention.
Merci beaucoup, Monsieur le Président.
Thank you so much, Your Excellency.
Heard. Thank you, and those pledges. Please join me, ladies and gentlemen, in welcoming to the stage the Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus, followed by the Executive Director of UNICEF, Catherine Russell. Welcome to the stage.
everything has been said. I may repeat, but I will make it short. Excellencies, heads of state and government, dear colleagues and friends, I thank the European Union, the Gates Foundation, and Gavi for bringing us together today. Outside WHO's headquarters in Geneva is a bronze statue of a child being vaccinated against smallpox. In the 20th century alone, it's estimated that smallpox killed more than 500 million people. But since 1977, there has not been a single case of smallpox because, thanks to vaccines, it has been eradicated. Thanks to vaccines, smallpox is no more and polio is on the brink. Thanks to vaccines, once feared and deadly diseases like measles and Ebola are now preventable. And as you know, since the advent of the expanded program on immunizations 50 years ago, since 50 years, vaccines have saved an estimated 154 million lives. And since 2000, that's the birth of Gavi, under-5 mortality has dropped by more than half, thanks largely to the power of vaccines. At the World Health Assembly last month, the nations of the world made history by adopting the WHO pandemic agreement. One of its key elements is equitable access to vaccines. Gavi's new strategy is its most ambitious yet. It seeks to protect more people against more diseases faster than ever before, and will be key to achieving the Immunization Agenda 2030. As we all know, we face many challenges. Drastic cuts in aid, coupled with misinformation about the safety of vaccines, threaten to unwind decades of progress. We live in a world in which nations seem more intent on harming than helping each other. I think President Mahama has already given an example. Our children should not be the ones to pay the price. Vaccines save lives. They allow individuals, families, communities, economies, and nations to flourish. To put it simply, Gavi's success is the world's success. And that's why a fully funded Gavi is essential for a healthier, safer, and fairer world. And I would like to take this opportunity to thank all those who have pledged today, and I hope this will continue and Gavi will be fully funded. Thank you so much. Thank you.
Ladies and gentlemen, please join me in welcoming to the stage Ms. Catherine Russell, Executive Director of UNICEF.
Thank you. Thank you very much, Excellencies, distinguished guests, esteemed colleagues. It's very good to be here with you. Thank you all for your patience and sticking it out this long. And I always love following Dr. Tedros, my great partner at the UN. So every child deserves the best chance at life. Not just some children, not just those born in the right place or at the right time, every child. This simple but powerful idea is the foundation of the Gavi Vaccine Alliance. I've just returned from a trip to Burkina Faso and Chad, 2 countries where the Gavi model is delivering life-saving results. In both places, I saw firsthand the impact of partnership in action, health workers reaching children in the most remote communities, families protected from deadly disease, and national systems being strengthened to sustain progress. Through the Gavi Alliance, we have seen improvements in child mortality in 78 different countries. This is an extraordinary achievement, one that speaks to the power of multilateralism, of science, and of partnership. For 25 years, we have worked with countries to develop immunization strategies, to shape markets, to lower vaccine costs, and to deliver life-saving vaccines. Our reach extends to nearly half the world's children. And in the most difficult settings, including those affected by conflict and disaster, UNICEF stays and delivers. We ensure that vaccines are kept cold, are safely administered, and are available to every child, no matter how far or how hard the journey. Thanks to the collective investments of donors and countries alike, Gavi's work, as you have heard, has saved over 18 million lives and generated an estimated $250 billion in economic benefits. This is the power of vaccines. This is the power of global cooperation, and this is the legacy we are here to celebrate, to protect, and to scale up. We cannot stop now. The world has changed. We must change as well. Reaching the most vulnerable children has become more difficult, logistically, politically, and financially, yet the needs have never been greater. Gavi's new strategy is the most ambitious yet. It aims to protect another 500 million children, expand access to life-saving vaccines, and strengthen our collective defenses against future pandemics. UNICEF is fully committed to supporting this effort. This includes helping diversify vaccine production. By 2035, we are aiming for up to 20% of Africa's demand for 8 key vaccines to be met by African WHO pre-qualified manufacturers. We are ready to include these suppliers in our tenders, bringing us closer to the goal of regional vaccine equity and resilience. We are deeply grateful to those who have pledged support for Gavi's next chapter. It's inspiring to see new donors joining the Alliance. Thank you to those who have pledged, and I encourage others to join as well in making this critical investment. Today, making vaccines accessible to every single child is within our grasp. So let's seize the moment, and let's do it together. Thank you all very much.
Thank you so much indeed to Catherine Russell and Dr. Tedros for those powerful reflections. What an honor indeed to have you both here. All right, so we continue and we will move to our next section. And for that, we will have the honor of hearing now from Nadia Calviño, who is the president of the European Investment Bank. And then we'll be hearing for some more ministers and more of Gavi's dedicated donor. Le doy la palabra. Thank you very much indeed. Nadia Calviño, take it away.
Thank you very much. Ladies and gentlemen, what an honor, what a pleasure to follow my dear friends, Dr. Tedros, Catherine Russell, WHO, and of course UNICEF are two of our most important partners around the world. Partnerships. This has been a key word expressed in many, many forms here this evening. And it is so because for Gavi, partnerships is not just a slogan, it's a way of working, a way of bringing together the forces for good with a cause that is really worth it. Now, as representative of the European Investment Bank, I know very well that time is money. So let me go down to 3 ways where we are reinforcing, deepening our partnership, a very successful partnership with the Gavi Alliance for the last years. First of all, building on our partnership under COVAX, which actually enabled the delivery of close to 2 billion vaccine doses to over 100 countries. The European Investment Bank is extending its €1 billion liquidity facility for Gavi. That means vaccine procurement, that means pre-financing future pledges and contributions to Gavi. That will allow us to accelerate That will allow Gavi to accelerate routine immunization, outbreak responses, So, in a nutshell, this means turning the pledges that we have heard tonight into real money. This means making projects possible on the ground. Now, secondly, the European Investment Bank stands ready to work with all sovereign donors that have also spoken here tonight and those that will follow to support their contributions to Gavi's replenishment. In an area where multilateralism is being criticized, I think it's more important than ever that we build bridges and that we show that acting together we can really make a difference. And thirdly, we want to also contribute to boosting vaccine production on the ground, local vaccine production. This is critical. Many have already said how Africa accounts for 20% of the world's population, but produces just 0.1% of its vaccines. This must change, and the European Investment Bank is proud to partner with Gavi's African Vaccine Manufacturing Accelerator so that we can support African manufacturers to become future Gavi suppliers. In South Africa, for example, our support for Biovac is expected to increase annual production in Cape Town to 500 million doses, enabling the manufacturing of both viral and bacterial vaccines and strengthening Africa's resilience to future pandemics. And this is not just investment in infrastructures. As many have said it this evening, this is investment into hope. So let me close with these thoughts, because countries everywhere need the resources to identify new disease outbreaks, to respond quickly, and the European Investment Bank, as a proud member of Team Europe, will work shoulder to shoulder with Gavi and our global partners, many of whom are represented here today, because just by joining our forces can we succeed in facing the challenges ahead. And I'm really proud to be at the helm of the European Investment Bank, an institution that is fighting for global health, because, dear friends, in today's geopolitical context, let me tell you, this is the good fight. Thank you very much.
Ladies and gentlemen, we now have a video message from His Excellency Xavier Bettel, Deputy Prime Minister of Luxembourg.
Distinguished colleagues, virtually, it is my pleasure to join you at Gavi's 6th Replenishment Conference. I want to thank the European Union and the Bill and Melinda Gates Foundation for co-hosting these important events for global health. I would like to underline Luxembourg's continued political and financial support to Gavi, our long-term multilateral partner. Global health is a global public good and a priority for our development cooperation and humanitarian action strategy. Equitably and sustainable access to immunization with a particular focus on the most vulnerable population is essential to ensure the right to health. The COVID-19 pandemic showed that global health is a complex ecosystem with a diversity of partners. Strengthening partnerships and multilateralism are therefore key to ensure global health security, pandemic preparedness, and universal health coverage. Luxembourg supports the current reforms of the global health architecture, including the need to design innovative financial instruments and local manufacturing of health products. Vaccine equity begins with access, and access begins with capacity. Therefore, I'm pleased to announce Luxembourg's pledge of €5 million to support Gavi's 6th strategy. We are looking forward to our continued collaboration with Gavi together with Team Europe, and I wish you a successful replenishment conference. Thank you for your attention.
Ladies and gentlemen, we now welcome to the stage His Excellency Åsmund Aukrust, Minister of International Development from Norway.
Dear friends and colleagues, Norway is a proud founder of Gavi, and we have been and continue to be one of the biggest contributors, both financially, technically, and politically. The world has seen tremendous results of Gavi's work. Norway's contribution alone has contributed to saving 1.9 million lives. The fundamental principle of Gavi is that we are stronger together. The best protection against outbreaks of pandemics is a healthy global population with access to health services, including childhood vaccination. Global health initiatives like Gavi, the Global Fund and the Global Financing Facility has been instrumental in reducing diseases burden and premature deaths in developing countries. We are living in challenging time. We are living in a world where there are less funding for development. Therefore, we also need to look into new ideas. This includes new opportunities for global health initiatives to work in partnership to better align and to integrate their activities in accordance with national health plan and priorities. This is in line with the Lusaka agenda, which suggests a focus on primary healthcare, equity in health, domestic health financing, as well as local production of medicines and vaccines. Norway remains a strong supporter of Gavi and the Global Fund. We expect all global health initiatives to make their operations and administrations more efficient, to collaborate better and remove duplication functions, both at a global and at a country level. Let me also highlight a particular challenge that the world is facing: women's and girls' sexual and reproductive health. They are under pressure, both financially and politically, and I welcome Gavi's and the Global Fund's very crucial role also in this area. Norway, we are stepping up for international solidarity. We are increasing our support for development assistance. Our government are achieving 1% of our income into development assistance. Therefore, I'm also happy to announce Norway's new contribution to Gavi for the period for 26 to 30. We are contributing with at least 5 billion Norwegian kroner, and combined with our commitments through IFIMs on 3.1 billion kroner, combined this will make at least 8.1 million Norwegian kroner, or approximately $800. I'm also happy to announce our pledge for the Global Fund on 2 billion Norwegian kroner for the next 3 years. We look forward to continue to play an active role of the boards and committees of both organizations to ensure and reform the global health architecture for benefit the most vulnerable population in the world. Thank you.
Ladies and gentlemen, please join me in welcoming His Excellency Randeep Sarai, Secretary of State for International Development from Canada.
Good evening, bonsoir, Your Excellency, distinguished guests. Let me begin by thanking our hosts, the European Union, the Gates Foundation, and Gavi, the Vaccine Alliance, for bringing us together with a common mission to protect the world's children from infectious diseases. As we all know, vaccines are one of the world's most effective, evidence-based health interventions. This is true no matter where a child lives, something Canada understands firsthand. This year, we've seen our largest outbreak of measles in decades, causing worry to many Canadian families about the risk of their young children. It's been a stark reminder that the benefits of investing in immunization programs far outweigh the costs. Because by reducing the global spread of disease, we help children everywhere stay healthy. Gavi provides immunizations for more than half the world's children each year, saving millions of families in 57 countries from life-threatening diseases like HPV, malaria, measles, and polio. Le Canada est fier de soutenir Gavi depuis
different maladies. Canada is proud to have supported Gavi since its very beginning.
million to support Gavi's efforts over the next 5 years. will help Gavi protect the world against future pandemics and disease outbreaks, as well as strengthen health systems and global health security. We look forward to supporting exciting innovations like the rollout of the groundbreaking new malaria vaccine, as well as practical climate-smart solutions such as installing 20,000 solar-powered fridges and freezers to ensure life-saving doses stay cold in remote areas. Canada's commitment will also support the International Financing Facility for Immunization to accelerate funding for Gavi to purchase vaccines and strengthen countries' health systems. As many of you have noted, we meet at a difficult time and profound geopolitical and economic uncertainty. Development organizations everywhere are being asked to do more with less. Yet the health challenges facing our world are not getting simpler. So working with an organization like Gavi, with its vast reach and strong track record of innovation and impact, remains our best path forward. Last week, Canada hosted the G7 Summit, where we demonstrated our commitment to strengthening our relationships with international partners and forging new collaborations. We're taking action to improve economic growth, advance global security, and stand up for Canadian values, ensuring that we care for those most vulnerable amongst us as we strive for a better future for all of us. The investments we make tonight are vital not only to save lives here and now, but to protect health and the prosperity for the next generation, because no child anywhere should die from a disease that immunization can help. Thank you once again. Merci encore.
Ladies and gentlemen, please join me in welcoming to the stage His Excellency Hisashi Matsumoto, Parliamentary Vice Minister for Foreign Affairs from Japan.
I'm honored to speak on behalf of the government of Japan at the Global Summit, Health and Prosperity through Immunization. Firstly, I'd like to express my deep respect for the leadership of the EU and the Gates Foundation and the dedicated work of Gavi's board chair, Mr. Jose Manuel Barroso, and its CEO, Dr. Sania Minister, for organizing the summit. I also would like to express my respect for the effort of the ministers, representatives of international organizations, and the participants who work tirelessly to protect the health and the lives of children and people worldwide. For 25 years since its establishment, Gavi has overcome numerous challenges. In particular, during the COVID-19 pandemic, Gavi made extraordinary contributions to universal health coverage by ensuring equitable access to vaccines, together with core organizations such as WHO. The government of Japan highly values these policies and activities of Gavi and supports them and as its vital partner. Immunization saves countless lives and leads to economic growth and health security. Gavi takes innovative initiatives to ensure equitable access to affordable and safe vaccines, such as strengthening vaccine manufacturing capacity in Africa and other regions. We are proud to contribute to these efforts, and we also expect that Japanese dengue and mpox vaccines, Japanese high-tech solutions, for example, fingerprint identification for vaccination records for infants, and the new vaccines developed by Japanese companies in the future will play even greater roles in the Gavi's work. Japan prioritizes global health as a key pillar of our foreign policy, with a view to protecting the lives and the dignity of every individual, as well as realizing human security. Japan has been engaging in the achievement of the universal health coverage for all people to have access to effective and quality health services. The Japanese government is collaborating with WHO and the World Bank to establish the Universal Health Coverage Hub. It will be a global center for knowledge sharing and human resource development to achieve universal health coverage in low and middle-income countries. Japan hereby promises to firmly and continuously support Gavi's mission, leaving no one behind with immunization. At the same time, faced with significant changes surrounding this mission today, we expect its strengthened collaboration and synergy with other international organizations in this field. Japan will keep to stand with Gavi to deliver impactful results in the next strategic period, Gavi 6.0. Thank you very much for your kind attention.
Ladies and gentlemen, please join me in welcoming now to the stage His Excellency Mr. Ki Hwan Kwon, Deputy Minister for Multilateral and Global Affairs from the Republic of Korea.
Thank you very much. Excellencies and distinguished delegates, I would like to extend my deepest gratitude to the European Union, Gavi, and Gates Foundation for convening this important and timely conference. Over recent decades, the international community has made great progress in its enduring fight against the disease. Yet persistent challenges remain, and the COVID-19 pandemic served as a stark reminder that disease knows no borders. Confronting them through solidarity is not a matter of choice, it's an imperative. In the global effort to combat infectious diseases, Gavi, the Vaccine Alliance, has been at the forefront of promoting equitable access to life-saving vaccines. The Republic of Korea takes pride in contributing to Gavi's remarkable achievements. As the first Asian country to join this endeavor in 2010, Korea has steadily scaled up its contribution over the years. Notably, we have contributed $330 million to Gavi to support the global effort in responding to COVID-19. In this spirit, we will continue to deepen our collaboration with Gavi and support its life-saving missions. Today, I'm pleased to announce that the Korean government will make an initial contribution of $50 million to Gavi for its 6.0 strategic period, with a view to providing additional support going in the years ahead. We encourage Gavi to strengthen collaboration with innovative and cost-efficient partners to enhance preparedness for future pandemics. The Republic of Korea remains committed to supporting Gavi and will continue to engage in global partnerships for a healthier, safer, and more secure future. I thank you very much.
Please join me, ladies and gentlemen, in welcoming to the stage Mr. Stefano Gatti, Director General for Development Cooperation from Italy.
Good evening. It's late, but never too late, to pledge for Gavi. So I have been asked by Deputy Prime Minister, Minister of Foreign Affairs of Italy, Antonio Tajani, to deliver his personal brief message to this conference. This is the message. Dear friends of Gavi, the strengthening of partner countries' health system lies at the core of Italy's health strategy in developing countries, with a particular focus on Africa and Italy's Mattei Plan for Africa. In these efforts, Gavi remains a key partner of Italy. Our partnership with Gavi has grown stronger over the years, especially during Italy's G7 presidency in 2024. Last year, on the occasion of the G7 Development Ministers meeting in Pescara, I chose to dedicate a session to global health, which was opened by Gavi's board chair, José Manuel Barroso. Through my remarks today, I wish to reaffirm Italy's and my own strong support for Gavi's mission and objectives. I have personally discussed our support to Gavi with our Prime Minister and have supervised the discussion between my ministry and our Ministry of Finance, with whom we share on an equal basis our financial engagements towards Gavi. I am therefore pleased to announce a contribution of €250 million to support Gavi's next... I told you it's late, but never too late. This represents a 25% increase compared to our financial commitment for the previous cycle. We stand ready to continue working together to ensure that the right to health becomes a tangible reality for all. Antonio Tajani. Thank you.
Ladies and gentlemen, we'll now watch a video from Her Excellency Dr. Anne Ali, Minister of International Development for Multicultural Affairs and Small Businesses from Australia.
Hello everyone, I'm Dr. Anne Ali, Australia's Minister for International Development. This summit is taking place at a critical time amid a backdrop of heightened global instability. Gavi's work saves lives, and it is now more important than ever for the world to come together to recommit to Gavi's mission of investing in vaccines as a key weapon against disease. During these turbulent times, Australia is steadfast in our commitment to Gavi. We stand by Gavi because we know countries in our region and around the world rely on Gavi's support. Australia values the invaluable work Gavi does in our region. And since 2000, Gavi has helped immunise more than 633 million children within Asia and the Pacific, preventing 6 million deaths. So today I'm very pleased to announce that Australia will commit $386 million Australian dollars to Gavi over the next 5 years. Tackling global health challenges requires sustained commitment. And that is why, despite the many competing pressures and demands, our funding for Gavi will not decrease. In addition, Gavi will also be able to access the $86 million previously pledged by Australia for COVID vaccines through the International Finance Facility for Immunisation. At this time of global uncertainty, Australia is proud to be an unwavering partner our friends can rely on. And by working together through the Gavi Alliance, we can promote innovation and equitable access to new and more effective vaccines. Now, I can't wait to see what Gavi will accomplish in its next program cycle. I want to thank our hosts, the European Union and the Gates Foundation, for your leadership in convening this summit. And thank you also to all the partners for your contributions to Gavi's mission. Gavi's countless successes are a testament to the power of partnership. Thank you.
And now, ladies and gentlemen, let's welcome to the stage the Honourable Sri Jagat Prakash Nada, Minister of Health and Family Welfare from India.
Excellencies and distinguished delegates, on behalf of the Government of India, I extend our appreciation to Gavi and all partners for the unwavering commitment to protecting the lives through promoting global health and immunization efforts. Our journey from Mission Indradhanush to launching CoWIN and UWIN, through which we vaccinate over 2 million children a month, demonstrates our commitment to reaching the last mile with life-saving vaccines. India is proud to have partnered with Gavi for over now 2 decades. India's robust vaccine manufacturing capacity, which contributes to 60% of the global vaccine supply, has enabled Gavi to immunize more children within the same financial envelope. Enhancing cost efficiency, expanding reach and accelerating progress towards global immunization goals and saving countless lives. Excellency, India pledges to support Gavi for 6.0 strategic cycle 2026 to 2030, and we take this opportunity to announce our financial contribution of $20 million to Gavi, according to the vision of the Prime Minister for fulfilling India's role as Vishwabandhu, a trusted partner to the world. This contribution reflects India's reaffirmation of our steadfast commitment to building resilient, inclusive, and equitable health systems globally. Immunization remains a powerful tool of hope, equity, and global solidarity. As we move forward together, let us strengthen our collective efforts to ensure that every child has access to life-saving vaccines and a healthier future. Thank you very much.
Ladies and gentlemen, now we'll hear a video address from His Excellency Ong Ye Kung, Coordinating Minister for Social Policies and Minister for Health from Singapore.
Excellencies, ladies and gentlemen, Gavi, the Vaccine Alliance, has been a beacon of hope and progress in global health. Since its inception, Gavi has championed equitable access to life-saving vaccines, protected millions of children and families from diseases, saved lives, fortified health systems, and enabled communities to thrive and flourish. The COVID-19 pandemic was a defining moment for humanity. During this unprecedented crisis, Gavi played a pivotal role in the global response. It did what it could, working with governments, manufacturers, and partners to overcome constraints to facilitate equitable access to COVID-19 vaccines, so that even the most vulnerable populations would not be left behind. COVAX delivered nearly 2 billion vaccine doses to 146 economies, averting over 2 million deaths. Objectively speaking, it was a monumental achievement, demonstrating the power of solidarity and the critical importance of investing in global health infrastructure. Yet, Gavi faced its share of criticism that it could have done more, that it could not totally eradicate vaccine inequality between economies. Sometimes it is not easy to be on the side of good. It takes courage and a strong sense of mission and purpose. Gavi has done this, and it deserves our strong support. This is why Singapore has been supporting Gavi. We first became a Gavi donor in 2020 during the COVID-19 pandemic, contributing $5 million to the Gavi COVAX AMC. As co-chair of the Friends of the COVAX facility, we work together with other self-financing countries to support the design, financing, and governance of COVAX. Singapore has also donated 1.6 million doses of our vaccine allocation through COVAX in 2021. We will now further support Gavi's investment case with a contribution of $1 million for the 2026-2030 cycle. We commend Gavi's bold strategy for the next 5 years. Singapore stands united with Gavi and many others in this effort, confident that through our collective contributions, we can build a healthier, safer, and more prosperous world for all. Let us continue to work together to ensure that no one is left behind, and that every individual, everywhere, has the opportunity to thrive. Thank you.
Ladies and gentlemen, now we have 3 video announcements, one from Simprints and Zipline, plus Bayer.
Hi, I'm Keller Clifton, founder of Zipline, the largest autonomous delivery network in the world. New constraints require us to innovate and to find better ways of solving old problems. With support from visionary philanthropies like the Elton John AIDS Foundation and matching funds from the Gates Foundation, Gavi is helping scale Zipline's autonomous logistics network across Ghana, Cote d'Ivoire, Nigeria, Kenya, and Rwanda. This is a true public-private partnership, and it's working. Earlier this year, peer-reviewed research confirmed that Zipline is the most cost-effective way ever studied to make interventions like this happen. The future of global health demands that we spend less and achieve more. In a world shifting from aid to trade, public-private partnerships like this are becoming a blueprint for how we can create capacity, jobs, and independence across Africa. Gavi is taking a big leap forward to build a more innovative future. Let's help them make this happen.
Globally, nearly 1 in 4 children born today have no formal record of their existence. This makes tracing vaccines to unique children challenging, both for health workers delivering immunizations, but also health officials using data to close coverage gaps. Since we became an infused space setter in 2018, Gavi and Simprints, with the support of match funds, have demonstrated that biometrics can help close this global identity gap, securely improving access to healthcare and immunization in Tanzania, Bangladesh, and Ghana. Our latest initiative will develop and scale contactless AI biometric models that work from birth. This partnership between Gavi, ARM, CIF, and Simprints will disrupt significant barriers to vaccination by eliminating dropouts, driving higher coverage rates, lowering cost per dose, and ultimately protecting more children. Health and prosperity through immunization can only be fully realized if every vaccine dose reaches the person it's meant for. Simprints' ongoing partnership with Gavi reflects a shared vision of every child in every community having access to life-saving vaccines.
Greetings, everyone. I'm Chitkala Kalidas, and I lead the Bayer Foundation. I'm happy to share with you that the Bayer Foundation, in collaboration with Gavi and other partners like Mtamadi and Elucid, has launched vaccination campaigns for zero-dose children living in rural Madagascar. And we are also in the process of scaling an innovative social business model that would enable cocoa farmers in Ghana to gain free access to high-quality healthcare. Continuing to work with Gavi to further scale our efforts and include countries like Nigeria and Ivory Coast as part of our footprint, and also include new value chains like coffee and cotton as part of our activities. We invite you to join our efforts. Thank you.
Ladies and gentlemen, please join me in welcoming to the stage Mick Sheldrick, co-founder of Global Citizen. The floor is yours.
Well, let's start by giving an incredible applaud to every single pledge you've just heard. Let's put it together. Let's applaud that. That's right. The fact this conference is taking place here and now speaks volumes. There's other summits taking place right now in the world that are preparing for the worst. But what this summit is about our best hopes for a better tomorrow. This is about placing a bet on the dreams, the aspirations, the hopes of millions of children. That's what's happened today. You can see it in the pledges. And the Honorable Prime Minister of Greece, he summed it up himself. He said, it speaks volumes that you've had prime ministers and presidents traveling from NATO, taking time out of their busy schedule to showcase what this means. The president of Ghana wowed us with his incredible personal story. I hope I wasn't the only one moved by that when he shared his brother's story. He shared how, thanks to Gavi, growing up as a child in his country has transformed from basically, you know, the luck of the draw when you're born to a real shot, a real chance at life. This is Gavi over 25 years. And so with that in mind, I've got two special announcements I'm going to make this evening before we wrap up, so please don't go. And by the way, Global Citizen, we're known for action taking, so I'm going to ask one action for you tonight. Pull out your phone. If you have any friends at the bar or who are about to leave in the bathroom, tell them to come back, because our next speaker you don't want to miss. It gives me incredible pleasure to announce and summarize the pledges you've heard this evening. Please welcome an incredible role model, a heroic leader, the chair of Gavi, affectionately known as the Professor. Please give it up, give him an incredible welcome, Professor Barroso.
Michael is the kind of guy that my mother would like to hear, listen, and I'm sure she will agree. I'm not sure that my father will, but my mother will agree. So thank you very much for your kind words. And Your Excellencies, ladies and gentlemen, dear friends, we are now concluding this part of the pledges. And let me just remind ourselves that when we started out on this replenishment journey a year ago in Paris, we did so in a world that was changing, and we knew very well that it will be extremely challenging. We all know that the political and fiscal realities of today are very different to when Gavi was established 25 years ago. And despite that, tonight, we have seen the power of immunization to bring people together. We have seen hope in a better future rekindled. I thank you all, but I really mean all, for that. Over the past 2 days, we have heard powerful commitments and we have seen visionary leadership. We have celebrated and strengthened partnerships between organizations, between countries, between regions. We have seen African countries lead the way with strong national commitments to co-financing immunization. And we'll see more financing for national immunization priorities unlocked in the future. Gavi's funding firepower will be multiplied through new innovative financing tools and a bold new model for engagement and partnership worth more than $4.5 billion with multilateral development banks. And I'd like to give also a special word of thanks to the Multilateral Development Bank for their renewed commitment to our common goals. We have seen our partners from industry step up with new innovations to push the boundaries of what is possible in vaccine delivery in even the most hard-to-reach communities. And we can say that this effort is leading us to over $200 million of price savings. This is also a contribution to our goal. We have seen initiatives like the African Vaccine Manufacturing Accelerator signal the birth of a new era for the biopharmaceutical sector in Africa, one that will strengthen vaccine supply resilience and health security worldwide. We have listened to many commitments made on this direction, confirming that political will to go ahead with this great project. It is AVMA, the Africa Vaccine Manufacturing Accelerator. But crucially tonight, we should stand back and be proud that this global summit has seen a record number of new and existing donors pledged towards Gavi. So we have enlarged the donors of Gavi, securing more than $9 billion towards our target budget of $11.9 billion for the next strategic period. Ladies and gentlemen, let's be absolutely honest from an intellectual point of view. When you consider the current circumstances, all the challenges we are facing and our governments are facing, indeed, this result is a historic result. This is a very important result. We know that it is not exactly what we wanted. Let's be honest about it. We had more ambition, but I think we can say that more than $9 billion is indeed a great result, and we welcome that result. Some donors, and we heard also some of them, were unable to pledge support today due to domestic cycles, so democratic cycles, internal issues, but we know, and I am absolutely sure about this, that those promises to come very soon with pledges are real, sincere promises, and they will keep them. So in fact, this is not yet the end of the journey for pledging what happened today. It's very encouraging to see that they are committed to go further, and they gave us clear assurances, some of them during the meeting today here, that they will come very soon with formal pledges that they could not come now because of democratic procedures in the respective countries. I would like also to highlight that we have welcomed more than 25 individual sovereign pledges, including at least 5 from first-time donors, and this is also something we should celebrate. This includes over $150 million from our private sector partners, and that's also very important that the corporates also contribute, because beyond the philanthropies, it's important that the companies also give their contribution, showing their social responsibility. Taken all together, this is a powerful testament to the commitment that immunization inspires. Despite the economic and political challenges that are changing the face of global health, it is heartening that Gavi and Gavi's purpose continues to inspire support. 1 year since we set out in Paris, we arrive at a new era for Gavi and for global health. We will set out on that new era together. We will face difficulties together. We will overcome the challenges ahead together, and we will achieve that brighter, healthier future that we all want for the next generations. At Gavi, our preparation for the next 5 years will enter a new phase as we digest tonight's events, and with a renewed and reinvigorated Secretariat, we forge ahead to deliver our bold and ambitious strategy. So a big thank you to you all, to our heads of state and government and our ministers for their leadership and their commitment, to our champions for your fellowship and solidarity, to our wonderful co-hosts. We'll be forever grateful to them for everything they have done to make this 48 hours possible. I hope everyone present found this time well spent. To the question, yes or no to the future, I heard a very strong, resounding yes. Yes to a future of health and prosperity through immunization. Thank you all very much.
Let's give it up. So I said there would be one more special announcement, a great surprise in store for all of you. You know, what the professor just announced, $9 billion is incredible. And that's even with some countries still yet to go to pledge over the coming months. And we still have countries today who have left the door open, which is incredible. That's why we believe at Global Citizen, we have to engage with culture. We have to stay active. This can't be the end of it. We have to keep the conversations going in living rooms, on iPhones, in classrooms around the world. We can't stop now. But on the subject of culture, that special surprise, please, I want to introduce a very special friend of ours to lighten the mood, get us all active, hopefully some of us to even get up and dance. Please welcome, give her an incredible welcome for Nigeria's own daughter, the incredible, the spectacular ladies and gentlemen, excellencies, please give her a shout out for the one and only Valana.
Good evening, everyone. It's a brilliant honor to be here. Before I speak, I'd like to warm the audience up, so we're going to get you guys singing as well. Is that okay? Excited? Okay. So if you know any of the words to any of the songs, please, please sing along. Are you ready? So I guess while we're getting our instruments set up, it's a beautiful privilege to be here this evening. I feel very honored, and I just feel particularly honored because we're in a world right now that there's so many dark things happening in the world around us, but we're here in a moment where there's so much hope. We're pledging into the future, we're pledging into children and prosperity and immunization and access to health, which I think is so beautiful. So I just wanted to congratulate everyone in this room for being here for such a momentous moment. So thank you so much. One, two, three. My tea's gone cold, I'm wondering why I got out of bed at all. Morning rain clouds out my window, and I can't see it all. And even if I could, it would all be great with your picture on my wall. It reminds me that it's not so bad, it's not so bad. I want to thank you for giving me the best day of my life. And oh, just to be with you is having the best day of my life. Worry, worry, all I jimoken, all I jimoken, all I jimoken. Worry, worry, all I jimoken, all I jimoken, all I jimoken. Worry, worry, all I jimoken, all I jimoken, all I jimoken. Worry, worry, all I jimoken, all I jimoken, all I jimoken. Baby, the weather is getting cold, cold inside, doubly sweater. I'm yours, ordinary, paranoid. I can't picture this life without you, my life. Oh, I. Oh, I. Looking out, yeah, across the nighttime, the city wakes a sleepless eye. Hear her voices shake my window, sweet seducing smile, singing with me and they say why? Tell them that it's human nature. Why would you do me that way? They say why? Tell them that it's human nature. Why would you do me that way? Would you do me that way? Would you do me that way? By I don't want nobody to be my jacket. For this life I lay, I want to be celebrated. Don't wanna waste my days, I want to spend them on enjoyment. It's plenty, oh, but I'm in this, one me, one you, everyday party, raindrops on roses and whiskers on kittens, bright copper kettles and warm woolen mittens, brown paper packages tied up with string. These are a few of my
So can we get the key? So I'm gonna sing the part to you, and you're gonna sing it back to me. And I'm gonna point to you in the song when it's time to sing this part. It's very easy, I promise. And you sounded very beautiful on my favorite things, okay? So I'll sing it, it goes like this. So this song is called Woman. And I wrote this song because I am a single woman living in Nigeria. And one day someone came to my house, knocked on the door. So I opened the door and they said to me, "Excuse me, I'm looking for the head of the house." And I said, "Yes, how can I help you? How can I help you?" He said, "No, I'm looking for," in Nigeria we say, "Oh God, the boss of the house." He said, "No, not you, the man of the house. You now, woman." Okay, let me pause that story. Let me tell the other side. So one day I'm in an Uber. I'm going from one place to another, and the car is driving, and someone cuts him off in traffic. So he gets very angry, as people do, and he drives up front, and he looks to the left. He said, "Who is this crazy person beside me?" And he looks at, "Oh, now woman." And I thought, this now woman is almost like an insult. He's degrading, right? So I said, okay, I'm an artist, I'm a musician, and my power is in my music. So I thought, what if I take this now woman, it's in Pidgin English in Nigeria, we speak Pidgin. Take this now woman and make it an empowering thing that young girls can sing to themselves. So I thought if I make it, woman like water, woman like fire, woman like sunshine, woman like moonlight, woman like shelter, woman like healer, woman, now woman, oh woman, now woman. So that was the course of the song. And my dream is one day that young girls will skip down the road singing, "Woman, now woman, oh woman, now woman," and feel empowered, because we're talking about humanity and the future of young girls and of young boys and things like that. So it's very important I tell this story when I sing this song, so you understand it, and I sing it from my heart. So, did you guys still remember your parts? Perfect. Okay. Don't worry, I'll cue you guys, and Constance here will help you. Ready? If I shut my eyes on you, where will you find your light? If I turn my back on you, where will you find your strength? If I shut my door on you, where will you rest your head? When I find my voice again, when so many
shelter, woman like healer, woman now, woman, oh woman now, woman.
Thank you guys so much for singing with me. So I have one last song today. It's a new song. It's called Nostalgia. And I hope you enjoy.
Driving through the city, listening to Beyonce and Wizzy. Song is playing on and on and on, on and on and on, yeah. Can't escape our history, it's like you always with me. Memories go on and on and on, on and on and on, yeah. I remember the day that we met, it was Sunday. We were with other people and then you saw me. If I can turn back the time, I would say that I'm sorry. But baby, it's over now. All we had was late nights, beach days, cuddling. All we had was cheap wine, cozy Mondays. Now it's all just goodbyes, cold nights, lonely. All we got is na-na-na-na-na. There is no me without you. Tell me what tonight go do. I lost myself when I lost you, lost you. Feels like I'm running in place, trying to find my way. Maybe the truth is I miss you, miss you. Kissing on my forehead, telling you my feelings, yeah. Sexual healing, giving life meaning, yeah. Yeah, yeah, yeah. Kissing on my forehead, telling you my feelings, yeah. Sexual healing, giving life meaning, yeah. All we had was late nights, beach days, cuddling. All we had was cheap wine, cozy Mondays. Now it's all just goodbyes, cold nights, lonely. All we got is na-na-na-na-na. I remember the day that we met, it was Sunday. We were with other people and then you saw me. If I can turn back the time, I would say that I'm sorry. But baby, it's over now, over now. All we had was late nights, beach days, cuddling. All we had was cheap wine, cozy Mondays. Now it's all just goodbyes, cold nights, lonely. All we got is na-na-na-na-na. To be stranger is stranger than friends. I guess all good things come to an end.
Thank you very, very much. Thank you so much, Gavi, Global Citizen, and the Gates Foundation. It's a pleasure. Thank you.